Welcome back to Studio 10. Thank you for joining us this morning. Now, unfortunately, sometimes things can go wrong after breast augmentation surgery. If you've had breast augmentation and you're not happy with the results, Dr. Scott Ennis from Destin Plastic Surgery says all hope is not lost. Dr. Ennis, how often does someone come to you and need breast revision?
Actually, it's unusual, and one of the most important things, Cherish, is to actually have them done right in the first place. So there's a couple things you always want to do. You always want to put implants behind the muscle, and particularly want to use the new silicone implants. When you put an implant in the body, your body will always form a scar around it. The goal is to have that scar to be nice and soft so it feels like normal breast tissue. In smokers, into the implants on top of the muscle, that sometimes the implant can get very hard. It can make them feel hard. You go to hug somebody and you feel the breast really hard. Typically, it's because the implant's on top of the muscle. So one of the things we can do is we can take that scar tissue out, softening the breast, so rather than having a hard, very uneven look like that, it evens the breast up, much more natural appeal. Sometimes they can get hard, sometimes they run into rippling. And what rippling is, Cherish, especially with the old saline implants, is where you can see and feel ripples in an implant. So for a long time we weren't able to use the silicone in the United States, and we had to use the saline implants. And in thin women that didn't have a lot of breast tissue, it was very frequent where you can see some rippling in the breast, such as this right here. So you put on a bikini, a low-cut shirt, and lean over to pick something up, and you can see the rippling. So one of the big advantages of the new silicone implants is they tend not to ripple like that. These new silicone implants are the new cohesive gel implants, so a lot of people call them the gummy bear implants, because you can cut them right in half and you don't worry about them leaking like the old silicone implants from back in the 70s and 80s.
This is completely different material inside now.
Absolutely. This is a silicone gel. The old implants were a silicone liquid. They took those off the market back in 1992 because they wanted to study them and see. The end result of all those studies is that silicone was actually quite safe. It was just coincidental people had silicone implants and happened to have aches and pains. These new ones came out in the mid-90s. Everybody else in the world started using them, but it wasn't until 2006 at the FDA in the United States started letting us use them for everybody, especially for cosmetic purposes.
And this is just salt water?
Yep, and the problem is it doesn't reproduce the feeling of breast tissue very well, and that's why we end up with issues with rippling with saline implants.
So do you use these at all anymore?
Very rarely. Most everybody's gone back to the silicone implants now because they like the way they feel better, they don't ripple, and they give you a much more natural look and feel to the breast. Sometimes, obviously, implants can be too big, but actually implants can be too small too. So we base implant sizing more on width than we do volume. So the bigger the implants they get, the wider they get. So one of the most important things we can do when picking an implant for somebody is to pick it based on a width that fits the width of their chest. You can see in this girl, she does have implants, but has a very large space between her breasts, which is considered very unattractive. By going to a larger implant that fits the width there, it actually is much prettier and gives them much prettier cleavage. Here, they're too far apart. Now, this is closer, it gives her much prettier cleavage.
What is this on the top of her breast? It looks like a capsule.
It's actually a wrinkle in the implant. Oftentimes, especially the saline implants, when they were on top of the muscle, you can see a crease or what they call a fold in the implant here. And it can be visible through clothes and bathing suits as well. The way we fix that particular situation is we actually put the implant under the muscle. When the implant's under the muscle, it gives the breast a much better teardrop shape to it. It supports the weight of the implant. Mammograms are much, much better when the implant's behind the muscle, and they're overall much prettier. So lots of reasons we end up having to redo things. It's unfortunate, but most all those issues can be fixed.
Dr. Ennis says the doctors at Destin Plastic Surgery perform close to 800 breast revision surgeries each year. If your breast augmentation didn't turn out the way you thought it would and you'd like to set up an appointment with Dr. Ennis, you'll find his phone number on our Studio 10 webpage on fox10tv.com. Holiday